Hey everybody, Andy House with the Bald MP. Pain scores. We're talking about pain scores tonight. That's when you go to the provider and you circle what's your pain today between 0, no pain, or 10, which is the worst pain you've ever had in your entire life this minute. All right? A lot of times, for ladies, it's childbirth. Men, they say it's kidney stones. What I'll tell folks is it's kind of like when you're walking back to the bathroom in the middle of the night and it's in the dark and you kick that bedside table with your big toe. Makes you almost forget your religion, y'all. I'm telling you. But I digress. Pain score. It's very important, people. Your provider looks at it carefully, especially if they're one of the ones that's treating your pain or if it's a new problem or something like that. We look at that stuff. We do. So, look, y'all, if you're sitting up there cross-legged on the exam table, looking at your phone, it's a good chance not being the worst pain you ever had in your life, or you hadn't had any pain before in your life, okay? So, accuracy, guys, accuracy. The best you can do, right? Accuracy. And two, that if you're working with a provider and they're trying to treat your pain, okay? They're trying injections, they're trying medicine, they're trying therapy, or you're talking to your physical therapist, occupational therapist, what have you. And they ask you for your pain scale. It's okay if you're having a good day. It's okay to have, 5, 6, 7, 2 when you come in and just say, hey, my pain's a 2. Today's a good day. I don't know why. I can't explain it, but it's a 2. That's honesty, y'all. That's honest. Just be honest. That's all. That's all. And because if you've been seeing somebody 6 months, a year, or longer, and you look back and they're 8 the whole time, that ain't gonna work, y'all. That means everything they've done hasn't helped. Okay? At the very least. So, all I'm saying, good, accurate pain scores at the time you're being asked, right? It could have been an 8 this morning. You got up, took some medicine, stretched, got up, had a cup of coffee. Now it's a 3. Hey, okay. That's when you talk about it. Conversate. So, that's all. We working together. Pain score. Y'all have a good one.